I'm from East Austin. I went to Dell Medical School. I work in my neighborhood. I care for my patients at Central Health. I'm Brooke Wagen. I graduated with pre-med and like a degree in biology and Spanish in the 90s, and actually made the decision at that time not to go to medical school, even though all my peers at that time were going to medical school, because I wanted to take a break. For a long time, going to medical school was this thing that I held on to as this sort of thing that I would get back to. And then after 2 children, 4 miscarriages, and then the adoption of our last child from Ethiopia, when we were on the airplane home from Ethiopia with her, my husband almost died of an anaphylactic reaction. And I had a moment where I just let go. I finally let go of medicine as part of my identity. I said, well, this is a thing that I'm doing now. And 2 years after my daughter came home, there was the bond to open a med school in Austin. And I was a homeowner. I lived on the east side already. And I remember very clearly deciding to vote for the proposition. So I thought, well, it'd be awesome if Austin had a med school. And then I joked to a friend, I said, wouldn't it be awesome if I got to go there? But at that time, I also was really involved in my neighborhood. I drove Meals on Wheels, and I got to firsthand see what people go through when they are sort of on the edges of the healthcare system and don't have anyone to advocate for them. So when the med school finally opened, I was applying to be in that first class. I think if I had gone to medical school when I was in my 20s, I would have been worried about myself, thinking about myself. And going to med school when I did, I was very aware of what a gift it was to be there and what I wanted to do, which was to serve my neighbors. I started thinking about Central Health before it provided medical care, because my first primary care mentor, and I knew that I loved primary care, was Pete Zamora, or Guadalupe Zamora, who's on the board of governors for Central Health. He practices medicine probably 4 blocks from my house. I had taken my children to see him as a patient. Then when I was assigned a primary care preceptor at Dell Med, it was Guadalupe Zamora. And I don't think that was chance either. I started working at Central Health in August of 2024, and it perfectly aligned with my vision for what I wanted to do with my new medical training. And the job that I have now did not exist when I started med school. It did not exist when I started residency, and it didn't exist when I started fellowship. But when I heard that Central Health was going to start doing specialty care, I wanted to do this. And of course, the pieces all fell into place. So it's the only job that I applied for because it was the perfect fit. So supportive and palliative care is a kind of medicine that provides an extra layer of support to patients and families going through hard things, whether that be for the patient or often for the patient and the family. We specialize in symptom management, but also in looking at the big picture. I often tell my patients that I'm the doctor that has time to step back with you and look at your life from a 10,000-foot view and say, what's going on and why does this matter? And how do I help?